Hi everyone, thanks for joining. We're going to get started now. Today we have approximately 30 minutes, and as a reminder, one question, one follow-up. We have Dr. Moore here today, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Bon après-midi à tous. Today there are 587 new cases of COVID-19 in Ontario. There are 279 people in hospital and 149 in the intensive care unit due to COVID-related critical illness. And I'm sorry to say that there have been another 6 deaths that have been reported. Our vaccination rate continues to climb. Currently, 86.7% of eligible Ontarians have 1 dose and 81.8% have 2 doses of a COVID-19 vaccine. A total of 37,057 tests were processed yesterday with a positivity rate of 1.7%. We're moving closer to our target of 90% of eligible Ontarians vaccinated, which will help to slow the transmission of the Delta variant. Thanksgiving is coming up, a special time of year for many Ontarians, and an opportunity to show appreciation and gratitude. I am only too aware of the negative impacts and the social isolation can have, and the need to spend time with our loved ones. That is why we want families to embrace the opportunity to get together for their mental, physical, and social well-being. Last year, Thanksgiving looked very different for many of us. In-person celebrations were limited to immediate households, and virtual celebrations became more common. But thanks to our collective efforts to get vaccinated and to follow public health guidance, we are able to gather together with friends and family to celebrate Thanksgiving this year, provided public health measures are followed. Pour beaucoup parmi nous, le jour de l'Action de grâce était un peu différent l'année dernière. Les célébrations en personne étaient réservées aux membres du ménage immédiat et les célébrations virtuelles sont devenues beaucoup plus communes. Mais grâce aux efforts collectifs des Ontariennes et des Ontariens qui se sont fait vacciner et ont suivi les conseils de santé publique, nous sommes en mesure de nous rassembler avec notre famille et nos amis pour célébrer l'Action de grâce cette année d'abord que toutes les mesures de santé publique sont suivies. If you choose to host an in-person social gathering this year, remember that under Step 3 of the roadmap to reopen, you can have up to 25 people indoors and 100 people outdoors. But the fewer people who gather, the lower the risk of transmission. And outdoor gatherings are always safer, so use outdoor spaces whenever possible. When gathering outdoors with a group of fully vaccinated individuals, no face covering or physical distancing is necessary. But if you are gathering outdoors with people from multiple households who are unvaccinated or partially vaccinated, or their vaccination status is unknown, please consider wearing a face covering if physical distancing cannot be maintained. And when gathering indoors with a group of fully vaccinated individuals, you could consider removing your face covering if everyone is comfortable. But if you gather indoors with people from multiple households who are unvaccinated or partially vaccinated, or you don't know whether they've been vaccinated, you should wear a face covering and physically distancing. Et lorsque vous vous rassemblez à l'intérieur avec un groupe de personnes entièrement vaccinées, il est possible pour vous d'enlever votre couvre-visage si tout le monde sont d'accord. Mais si vous vous rassemblez à l'intérieur avec des gens venant de multiples ménages qui sont non vaccinés, partiellement vaccinés ou dont le statut de vaccination est inconnu, vous devriez porter un couvre-visage et garder vos distances. Regardless of setting, you can wear a face covering and physically distance if you feel it is right for you, especially if you or others are immune compromised or at high risk of severe disease or exposure to COVID-19. No one should attend a Thanksgiving or other social gathering if they are sick. even if people have mild symptoms. Please stay home and get tested. Make your event as safe as possible. You should also provide hand sanitizer, soap and water for your guests to wash their hands frequently. Cover your coughs or sneezes if possible. Keep the windows open to increase ventilation and ensure high-touch surfaces are cleaned and disinfected. Halloween is also around the corner, and I know our kids are eager to fill up their bags and pillowcases with candy. So I did want to share a few measures that people should consider as they prepare for Halloween. Trick or treating should take place outdoors as much as possible. Be creative. Fashion a face covering into your Halloween costume design. But remember, a costume mask is no substitute for a proper face covering. Do not overcrowd the doorsteps. Take turns and keep interactions brief. Maintain physical distancing as much as possible. L'Halloween arrive bientôt et je sais que nos enfants ont bien hâte de remplir leurs sacs et leurs têtes d'oreiller de bonbons. C'est donc pourquoi j'ai quelques mesures à partager avec vous que les gens devraient prendre en considération dans leurs préparatifs d'Halloween. Passer les bonbons d'Halloween devrait se faire à l'extérieur le plus possible. Faites preuve de créativité. Intégrez un couvre-visage à votre costume d'Halloween, mais attention, le masque de votre costume ne remplace pas un couvre-visage en bonne et due forme. Ne soyez pas trop nombreux à la porte. Prenez votre tour et ne vous attardez pas. And for the slightly older trick-or-treaters who might be considering attending or throwing a Halloween party, all the guidance that I had previously outlined for Thanksgiving and other social gatherings applies to you too. And it bears repeating, if you are sick, even with mild symptoms, you should not be participating in social events like Halloween. We know from experience it is exactly these kinds of events that can lead to spikes in transmission. But provided we do our best to follow the guidelines in place, we can enjoy some well-deserved time with friends and family while also keeping our community transmission low. I also wanted to address different kinds of events, and today it's about weddings. We have noticed a number of outbreaks associated with weddings, in particular wedding receptions. I know that getting married is a special moment for couples and their families, and that no one wants COVID-19 as one of the guests. It's imperative that public health measures are followed to ensure the health and safety of the happy couple and their friends and families. Also note that while the current regulation states individuals who are not fully vaccinated attending a wedding reception in a meeting or event space can provide proof of a negative COVID-19 test in order to attend, this exemption expires on Tuesday. This means that as of Wednesday, October 13th, proof of vaccination or an eligible exemption will be required. Il est à noter aussi que présentement, les gens qui sont invités à une réception de noces n'ont qu'à montrer la preuve d'un test négatif pour la COVID-19 pour pouvoir y assister, mais cette exemption prend fin mardi. Cela signifie qu'à partir de mercredi, le 13 octobre, la preuve de vaccination ou d'une exemption admissible sera nécessaire. I know that we continue to call on Ontarians to make sacrifices, to change habits, and to be vigilant. And the last 20 months have been challenging and stressful at times, even distressing. I sincerely hope that you are able to spend time with loved ones this weekend, whether in person or virtually, and to relax, reflect, and give thanks. And if you haven't already, please take the time to get vaccinated this weekend. This Thanksgiving, a vax-giving. And as we head into this Thanksgiving weekend, I want to take a moment to express my gratitude and my thanks to all of you. Et alors que débutera la fin de semaine de l'Action de grâce, je saisis l'occasion de vous exprimer à tous ma gratitude et mes remerciements. I am extremely proud and thankful for your continued efforts to mitigate the spread of COVID-19 in Ontario, And thanks to you, we are managing to keep the fourth wave under control. Thank you. Merci. And with that, I'll just make one additional comment. Today, we have released further information about our third dose strategy in Ontario. We have released a guideline with a list of immune-compromising medications that will make individuals taking these medications eligible for the third dose. And also, we're expanding to all retirement homes and elderly congregate living settings, not just long-term care facilities, those living in those institutions and areas, the ability to get their third dose. Updated guidelines are on the ontario.ca website as we speak, and we will be implementing this with our public health, retirement home, primary care partners, and pharmacists over the coming days. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Allison Jones with the Canadian Press. Please go ahead.
Oh, hi, Dr. Moore. I just wanted to ask about Halloween to start. I noticed that one of the bullet points in the guidance is for kids not to sing or shout for their treats when trick-or-treating. Just curious how you envision that going. Kids generally go to the doors and shout trick-or-treat. Should they just not be speaking at all?
Oh, no, I mean, they'll have masks on. It's just not to yell too exuberantly. I think the purpose of that comment was not to aerosolize, and it's just a risk reduction strategy. Clearly, you have to make your presence known to get your treat, and you have to be able to knock as well as ask for the treat. We just ask not with a high volume that could potentially aerosolize. It's an abundance of caution, and last year when Halloween was present in Kingston and I was giving out candies, kids were great, and the event went smoothly without any issues, and the children were all reasonable and lined up appropriately. So I certainly hope across Ontario it goes well again this year.
Follow-up?
Thanks. On another topic, we're starting to see workers in hospitals and long-term care homes lose their jobs over the mandatory COVID-19 vaccination policies. Likely we'll see even more of that over the next few months. Are you worried about the impact that these staffing shortages could have in the middle of a pandemic?
With any policy, we absolutely worry about unintended consequences of any policy. And certainly we're watching that situation closely. We've watched where it's been fully implemented across the health sector in Quebec and in British Columbia. I'm saddened that individuals won't get immunized. I think as a healthcare worker, anywhere you're working in a high-risk environment, whether it's long-term care, acute care, it's your personal obligation to be vaccinated to protect the patients you serve and you provide care for. And I believe strongly in that. And I'm happy to say the vast majority of healthcare workers have come forward because they feel obligated to protect them, their families, and friends as well. There are a small percentage that aren't, and I'm very saddened that the potential of losing their jobs coming forward. It is absolutely not our intent. Our intent through these policies are that they embrace the opportunity to be immunized, to protect themselves, to protect their families, to protect the patients that they are honored to care and serve. And that is our an entire wish is that they become immunized. These vaccines